You are on, sir.
We are live on Facebook, and I am once again reminding everybody, while we don't have to wear our masks, you are permitted to wear your masks if it makes you feel safer, makes your family feel safer, makes everybody you come into contact feel safer. Um, Masks are still permitted, allowed, and in some instances still required if you're going into a medical setting or other settings. Alan Weber here from City Hall on a Friday with Dr. Wendy Johnson from La Familia, our go-to person on what's going on with COVID. And we will be visiting with Dr. Johnson. Let me give you a few data points from the vaccine dashboard. As of earlier this week, Santa Fe County had 72% of our residents with at least one dose, and about 61% of our residents fully vaccinated. And that may even be low because that doesn't include people who may have gone out of state when they got impatient or were getting news if they went to Texas, went to Colorado, they could get vaccinated. So it may be more than 61%. So that's some positive news. Some concerning news. If you look at the number of cases over the last week or so, we've had some very spiky days. 13 new cases, 16 new cases, 15 new cases, an average of 14 cases over the 3-day weekend, 17 cases the day before that. So on the one hand, our vaccination rate is up. We are now at a place where if you have 25 people or so, the state will come to you and give you a vaccination with your group, whether it's a neighborhood, a business, a nonprofit. If you can pull together 25 people who are unvaccinated and would like to be vaccinated, we now have the opportunity to make that happen. But we're seeing these increased number of cases on a day-to-day basis, and it's hard to understand, and it is concerning. And so let's start there, Dr. Johnson. Do you have a feel for why those cases are going up like that, and what could be done? And welcome.
Yeah, I mean, I'll tell you a story from my clinic. The last few weeks, I would say about once or twice a week, I'm getting, calls from a person who's gotten COVID and their whole family has gotten COVID. And most of these situations, all of these situations, are situations where people have not gotten the vaccine because they've fallen prey to the very many conspiracy theories and misinformation. Most recently, a patient I talked to this last week works in one of the works in a, I won't say the kind of thing she does, but an essential job, a lot of contact with the public, and obviously she's not working now that she's had COVID, but she's in isolation. But she, has gotten through this whole pandemic, 15 months now or so, without getting COVID. And, she had some other chronic diseases, which would have made her eligible for the vaccine real early on, several months ago. And our clinic called all those people, sent them texts saying, come in, call us, we'll get you the vaccine. We've been calling those people for a couple of months now, a few months. And so I know she got the call, and she said she did get the call. And I said, well, why didn't you get the vaccine? And she said, well, isn't it true that if you get the vaccine, you'll shed the virus and infect other people? And I said, oh, no, it's not true. And, now this person has COVID, her whole family has COVID, and including some young kids, including a parent who's in the hospital. So, they're at risk for long form COVID, which, we don't know a lot about, but there's so many people that I'm seeing now in my clinic that have long-term dependence on oxygen or problems with their oxygenating their blood and their bodies, and real problems with shortness of breath, long-term chronic fatigue, long-term kind of cognitive issues and fogginess, long-term loss of taste and smell in some cases. So it's very serious, even if there's kids that are getting very serious diseases as well, very serious forms. So even if you're young and healthy and you think, I don't have to worry about it, I'm concerned about the vaccine, please educate yourself. These are among over 1 billion people in the world. I've said this almost every week, I think, but it bears repeating. Over 1 billion people in the world have gotten these vaccines, all the different kinds. And, we've been tracking them like we've never been able to track vaccines in real time because of our communication tools and technology and the internet. So things like if you've gotten a vaccine, you get texts from the CDC saying, hey, how are you doing? A day after, 2 days after, a week after, you can sign up for this. And anyone who has an adverse reaction to the vaccine anywhere in the United States, we're compelled as the people giving the vaccine to report that to the CDC. So they're getting real-time reports, any kind of adverse reaction. So we know for a fact that these vaccines are among the safest vaccines we've ever developed and among the most effective we've ever developed. So I really, really hope that that's what I'm seeing. I'm seeing like these little pockets of vaccine hesitancy of people who haven't gotten the vaccine. And those are the families mostly. And those are the pockets that the COVID disease is finding. The virus is finding those pockets and ripping through those pockets. And people are being less careful now. So, we have people who are essential workers. They might not want the vaccine. They're going to work. We have tourists coming in who maybe also, don't believe in COVID. We don't have the mask mandate in the same way. It's an honor system now. So if you're vaccinated, if you're not vaccinated, we can't tell by looking at you. But if you're a person who's not vaccinated and just doesn't believe in masks, this is the danger, that you're going around not wearing your mask. And I've seen some things on the internet, on social media. Well, those people aren't vaccinated. They had the choice. And so if they get sick, tough luck for them. Well, some people don't have the choice, like kids don't have the choice. We can't vaccinate kids yet. So and then there's some people who have autoimmune illnesses that might have gotten the vaccine and they might not have mounted a response. And so they're still very vulnerable. So that is also a myth. There's a significant number of people in our community, probably at least 50% of our community, that are still susceptible to COVID infection, either because they're not vaccinated, they're not fully vaccinated, or they got vaccinated, but their bodies just didn't mount immune response. So it's great that 70% of people in Santa Fe, for example, have gotten 2 doses. But remember, we have a lot of tourists here. We don't know how many of them have been vaccinated. And, some of the people who have been vaccinated might not have gotten their immune response. So maybe fewer than 50%, but a significant part of the population is still susceptible to COVID. So remember that. And again, I'll say again, me personally, I am respecting the only time I really am not wearing a mask is when I'm outside, because we have more and more information that it is really hard to get. Less than 1% of all transmissions are probably due to outside situations, especially if you're hiking or sort of distant from people or not in the same really close proximity with people for a long time. Outside is real safe. So that's the only time when I don't wear a mask now. But if I'm inside shopping, even at a restaurant, I'm still sort of avoiding inside dining. I've done a little bit of it, but not a huge amount. And so all of that stuff, I'm personally still being careful, even though I'm fully vaccinated. I just want to set a good example.
So on the theme of myths, I think you did some interviews with Capitol High students.
Yeah.
And tried to produce some myth-busting videos. Why don't you mention that briefly about what that was like, what the high school kids were talking about, and how they reach out to other people as the voice of young Santa Fe to remind us to not buy into the myths that just aren't true.
Yeah, that was awesome. We did it all in Spanish. So I don't know where it's going to be on the social media, on the internet at some point soon here. They're editing the final version. Maybe the Capitol High website or something like that, you can find a link to it, or maybe next week we can put the link to it on the call here. But it was really a lot of fun. Those kids are super smart and super professional. And it was like being on like Good Morning America or Univision, I guess, because it was all in Spanish. But it was, they did a great job of interviewing us, and they interviewed me and one of our care coordinators at La Familia, who has been doing our community outreach. And some of the myths we talked about were things
what were the
like,
myths? Yeah, what were
right,
the myths? What did they talk
right.
about?
We talked about, well, one of the things that my patient believed is that you can spread the COVID virus if you get the COVID vaccine. And that's absolutely not true. The COVID vaccine doesn't have any virus in it whatsoever that's related to COVID. It's absolutely impossible for you to either get COVID from the COVID vaccine or for you to pass it to somebody else. I hear all these stories about it affecting fertility, affecting menstruation. That's also completely untrue. There were all the trials that we've had and all the millions of people that have been vaccinated. First of all, thousands and thousands of pregnant women have gotten vaccinated, and there have been no adverse effects to pregnancy seen in the vaccines. The other thing is that a lot of people have gotten pregnant during the time they were getting vaccinated, or after they've gotten vaccinated, obviously. So it doesn't seem to have any effect also on fertility at all. Male or female fertility, no evidence of that either. Another one is it gets into your DNA and changes your DNA, or is it there's some kind of toxic thing in the vaccines that can, cause long-term problems. And the vaccines, a lot of vaccines, I can understand why people think that about some other vaccines, because they do have preservatives in them. And people are worried about small amounts of mercury or other kinds of preservatives. These vaccines actually don't have any preservatives in them. That's why we have to use them so quickly after we open a vial. We have to use them within a month because there's no preservatives in these vaccines. Okay, so if there are things that are already in your body. There are things like lipids, which form the membranes of your own cell. There's things like sugars. They're totally mostly natural things that you already have in your body, and that are proteins, things like that, that really that's why they have such a low rate of causing any kind of problem, including anaphylaxis, because they're things that almost nobody is allergic to or has any kind of bad reaction to.
So how young are we now vaccinating? What is it? If can I get vaccinated if I'm 12 years old and older? What's the current age limit?
That's right. 12 and older can get vaccinated with Pfizer. And we're expecting that within the next month or two, I expect Moderna and maybe Johnson & Johnson. Moderna will probably be the next one that we're allowed to vaccinate younger populations. If you're in that age group, I brought this up right here so I could tell people about it. You can call Christus, and they're offering Pfizer for patients 12 and older. You call 505-913-3080. I'm sure you can go to their website and find that as well. And the appointments are Wednesdays or Fridays. They're also offering for 18 and older Johnson & Johnson at their outpatient pharmacy in the medical professional building. And they're encouraging walk-ins Monday through Friday, 8:30 to 4. And in addition, you can set up appointments and you can see all the places that you can get vaccinated on the Department of Health website. So if you go to the Department of Health website and you put in your county, you put in Santa Fe, you can look at all the places where you can get vaccinated. Many of them are walk-in now. You can also see the phone numbers to call. If you can self-schedule on that website, so you can go on there, register if you're not already registered. If you're already registered, you can schedule for any of those places right on that website. So it's super easy to get vaccinated right now, many, many places.
And one thing tomorrow from 11 to 3, Department of Health, City of Santa Fe Public Library, Christus, Chainbreaker have collaborated to create a fun event. It's at the Southside Library on Jaguar Drive. It's part of Bike Month. There'll be fun giveaways an ice cream vendor for those who
Yeah.
are ice cream fans. There'll be anyone who's 12 years old and older can get a vaccine. Just show up, participate, get vaccinated if you're eligible, or any kid under 12 years old and up is eligible. It is fun, it's free, it's at the Southside Library. It's part of this push that Dr. Johnson, you just were talking about. Let's get to the point where we've hit that 75, 80% fully vaccinated rate. It doesn't mean we're out of the woods still. We're still working to get to the maximum number, but we're doing very, very well. And yet these spikes where you say people are sometimes based on bad information or myths, resisting the idea of getting vaccinated. Let's bust those myths and get everybody with some protection in their arm. Any last thoughts, Dr. Johnson?
Right. I just, for me, and I know for the people who are affected most of all, it's just heartbreaking, especially as folks who've been working as essential workers all through the pandemic, have avoided getting COVID. Like, don't be that tragic person who has avoided it for 15 months and then gets it, and especially, gets hospitalized or gets severe consequences. Don't be that person. Don't be that person. It's really tragic. It's really devastating. It can really be devastating for whole families. It can affect your ability to work and your ability to provide for your family. So don't be that person. If you do have questions, talk to your primary care provider, talk to somebody knowledgeable, and go ahead and do seek the vaccination, because it really, really does save lives. And so that's the bottom line.
And if folks have questions, they should email mayor@santafenm.gov, and we'll bring them up next week when we come back and see whether we're making progress, whether those 15 and 16 a day cases have gone back down to 3, 4, 5, because you're right. It would be a shame to make it all the way toward this close to the finish line. And even if we don't hear as much as we used to hear about the impact of COVID on people and their well-being and the long-term impact, it's a very nasty disease, and it can really have a tremendous negative impact. And still, we're still seeing people die from COVID. It's not like the disease has gotten any more friendly. It's a nasty disease. So get vaccinated, and as you say, if you're at all concerned or you want to demonstrate good judgment to other people, there's nothing wrong with still wearing a mask. It reduces the flu, it reduces allergies, and it's a good faith gesture to people who are working in buildings, 8-hour shifts, that you care about their health as well.
Absolutely.
Thank you, Dr. Johnson. Good to see
All right,
you.
we'll
have a good
see you
weekend.
next week.
All right.
Thank you.
Take care.
Bye-bye.
Bye-bye. Yep. So don't forget, folks, tomorrow, 11 to 3, Chainbreaker Bikes and Vaccines at the Southside Library. Also tomorrow, it's the NAMI Walk at Patrick Smith Park. It starts at 10:30. NAMI is the organization that really champions mental health. And as we've talked about in these webcasts before, we are dealing with a healthcare crisis that is both physical in the shape of COVID, but also mental health, how we respond to a year and 4 months of pressure, stress, loss, sadness, grief, recovery, but also a sense that it's been a hard year. And when we're honest about it, all of us, I think, have been under a lot of duress for a long period of time. We've had people suffer isolation, and isolation itself can be very depressing and saddening. We've had people suffer loss of family and friends, livelihood, job, businesses. So if you're feeling stressed, if you're feeling a sense of sadness or depression, mental health is something to talk about and take action to improve. It's nothing to be ashamed of. There is no stigma around better mental health for our community. The NAMI Walk tomorrow is a fundraiser for mental health. It starts at 10:30 at Patrick Smith Park. Please participate. Check it out on the web. I will be there. I will be testifying to just how important mental health is for our community. It's always been important, but as is the case with many things in this COVID period, the hardships of COVID have really put a spotlight on just how important mental health is for our community, families and friends. We really should step up, make sure people get the help they need. There is a governing body meeting on Wednesday. Lots on it. Check out the posting of the agenda. It's going to be a significant city council meeting. Before that, however, on Tuesday, there's a special meeting at 4 o'clock of the governing body to talk about bringing city employees and city buildings back to on-site work and open to the public. We're reopening the city in terms of all of our festivals, fiestas, our iconic markets, the opera, museums, stores, shops, hotels, restaurants are all reopening. But now we're talking about bringing city government so that the employees can come back, those who've been working at home or on a hybrid basis. Of course, there are many city employees who never were not working from the office or on the job, from the truck, from the car, from the vehicle, in the field. Those people deserve our thanks, of course, for being those essential workers. But we now have a plan we're working on to make the city open to the public in terms of interactions. There's still many ways to interact with the city using technology, e-permitting, filing reports, getting information, offering your insights about what we can do better through our constituent services office. But we do know that it's time to bring folks back to work on site. And there is a plan somewhere here on my desk. I've got a draft of it. It'll be discussed at the Tuesday, May 25th meeting of the governing body at 4 p.m. Obviously, we want to balance the importance of safety for everybody, our employees, people who are working in buildings, in enclosed spaces. We want everyone to be safe. As Dr. Johnson said, we don't want people to have made it this far and then suddenly get a dose of COVID. So tune in if you want to be part of or listen to the special meeting on the topic of our employees working back on site. There's a food depot distribution on Saturday, tomorrow, May the 22nd, 8 to 10 a.m. at Santa Fe Place Mall, 4250 Cerrillos. So that's a big deal. We still have folks who need help, who need food, who need our support. We don't want people in Santa Fe to go hungry. And the last thing I'll mention is the streetlight replacement project. We've seen a number of pilot project sites where you can go check it out. This past week, one evening, I went back down to Frenchie's Field to see how the lights looked, knowing that they'd put in some retrofit bulb covers to make the light softer and less glaring. Check it out. I think it's a real improvement. I also had the opportunity last week to speak to both the executive director of the Dark Sky Association and the gentleman who was the project director for the city of Tucson. So we continue to reach out to experts in street lighting and in the dark sky issue and in the energy saving, environmental sustainability field to find out how we can tailor the Santa Fe project so we become a dark sky designated city. I think it is a real part of Santa Fe that we want to see the night skies. We want to see the constellations, the stars. We want to feel like as a community, we're still a warm and small enough community that you can see the skies at night. You can enjoy the stars when you look up into the heavens. That about does it for me today. Thanks for tuning in. If you have questions about COVID, please do send me an email, mayor@santafenm.gov, and I'll ask Dr. Johnson when we get back together next week. In the meantime, have a wonderful weekend. Enjoy the beautiful weather. Get out and use the trails, ride a bike. Come on over to the Southside Library. If you have someone in your family or in your personal network who could use a vaccination, we'll be over there tomorrow morning. It will be a community event with ice cream and a lot of folks getting out to celebrate the way in which we are coming through COVID together. I can't think of another city in America that has done as good a job of dealing with combating COVID, hanging together, working together, praying together, helping each other. That's the spirit of Santa Fe. One other good fun thing that happened today as we reopen our community and celebrate together, there was a pushback of a new fire truck, actually 3 new fire vehicles, but the tradition goes back to the days when the fire vehicles were pulled by horses, and it's hard to get horses to back up, so they would have to push the new vehicle backward in order to get it into the fire station. Today, a beautiful new fire truck celebrated coming to our firefighters. And as I said at that event, we have the finest firefighters in America. We have the most courageous firefighters and EMTs in America. They've spent this last year, as they always have, but in COVID times even more so, keeping all of us safe, putting themselves in harm's way, recognizing that they were responding to the call of duty. They're number one. They're the best. They deserve the best. These new fire vehicles are the best. We got them with the help of the state, so a thank you to the state for the help in financing. And we continue to improve the quality of city government every single day with the people who work here, the equipment, the training, all of the things they need to do their jobs. And that includes police and fire, our alternative response unit that is now up and running, providing help to people who are not breaking the law, but who are in trouble because of being homeless or having a mental or emotional issue. Rather than treating that as a public safety issue, we treat it as a public health issue, which it really is. So please remember tomorrow the NAMI walk, mental health, vaccinations, public health. Have a good, safe, fun weekend as we open up the city for recreation and fun. More baseball, like the home run derby last week. We'll be continuing to go out to the parks, watch our kids have a good time, enjoy our recreational opportunities. Have a great weekend. Stay safe, keep yourself safe, take care of yourself and your family. Together, we will all take care of the city we love, the city of Santa Fe. I'll see you next week. Take care and bye.